First up is Simon Pickstone Taylor. He is a child and adolescent psychiatrist in private and also working at Red Cross. And he will be speaking on the demographic and mental health profile of youth in a gender service, an African case series. So I'm going to hand over to Simon.
Well, thanks for inviting me to be part of this. I must admit, after the two wonderful presentations, mine is likely to be a bit dull and concrete in comparison, but I hope that, it won't bring things down too much. Essentially, I'm presenting the first patients that were seen at the Gender Identity Development Service, which is really the service set up in 2012 to help gender diverse young people and their families in helping gender diverse young people. Most of them were seen at that service, but some also in my private practice. I'm just having a little bit of difficulty getting my slides on the screen. Can you see them, Alana?
Sorry, Simon, let me unmute. Yes, I can see them.
Okay, fine, good. Basically, I'm presenting a demographic and mental health profile of youth accessing the gender service really at Red Cross UCT, and it's a retrospective case series study. And Eugene Davids, Dr. Graham De Beaver, and Prof. De Vries helped me with this, all part of the UCT group. So the background is that despite a massive increase in global research on gender diverse youth, particularly from Europe and North America, there have been no studies in Africa on a clinical population. The aim was to present the first African findings of demographic and mental health profile of youth presented at a gender service, which is the service I've referred to. And the setting, a specialist mental health outpatient service in state and also private for gender diverse youth in the Western Cape. So what methods we used? All consenting youth seen at the gender service in state and also by the same clinician in private practice, namely myself at the Neurodiversity Center, between when the service started in January 2012 and May 2019, were subjects of a retrospective sequential case series. And pretty much everybody was happy to be part of the database and the study. Very few said that they preferred not to be. And data of interest, including gender identity and various other factors, were extracted from the psychiatry files of the subjects. We had 39 participants that were seen. 30 of them were seen in state at DCAP, the Division of Child and Adolescent Psychiatry, and 9 in my private practice. The age ranged from 4 years to 18 years. 15% of them were children and 85% of them were adolescents. So the majority were already had started puberty. 72% of them were white. So a more privileged background in general, and also talks to the demographics of who got referred to DCAP for gender issues. 15% colored and 13% black. For those that aren't aware, colored is an acceptable term in the Western Cape. In terms of language, 77% were English-speaking first language, 15% Afrikaans, and 8% isiXhosa. In terms of religion, just over 50% were Christian, 23% of the families identified as atheists, 8% agnostics, but also 5% Muslim and Jewish and unknown. In terms of sex assigned as birth, like other studies overseas, slightly over majority, 62% were female assigned at birth and 38 male assigned at birth. In terms of gender identity, uh, also 54% trans male and or non-binary, which really referred to the females assigned at birth. Non-binary tended to be the was females assigned at birth, because as you can see there, uh, 14 or 36% were trans female and one was a cisgendered male in the end. In terms of gender expression, the majority had gender identity match their appearance. Some androgynous, and only 5% did not match their appearance. So, some interesting demographics. Almost 60% had been bullied because of their gender identity. 20% had had romantic relationships in the past, and 20% currently had a romantic relationship when first assessed. And there was LGBT in their family, with 20% in their immediate family and 23% in their wider family. 49% wanted a name change, 20% to a more female name, and 26% to a more male name, or 4% to a gender neutral name. In terms of familial support, in general, what I want you to see here is the population coming had quite supportive families, 62% very supportive and 20% very supportive. Um, and so this obviously, I would expect, is a skewed population of more supportive families in general. In terms of health insurance, 26% had a comprehensive health insurance and 10% a hospital plan. So although these are very depressing figures, it's actually quite a privileged population for South Africa. Most people have no health insurance. And in terms of school type, 54% in government schools, 28% private schools, and 15% homeschooled. In terms of sexual orientation, as with other studies, the young people had far more diversity than in a normal cisgendered population. 44% heterosexual, 18% pansexual, 16% gay and lesbian, and 16% bisexual, and 6% asexual. In terms of their mental health, 80%, not surprisingly, had gender dysphoria because they were coming to see a gender specialist or a gender clinic for that issue. But also 5% had just attempted suicide or had a major depressive disorder with suicidal ideation. In terms of new diagnoses, 26% were diagnosed with autism for the first time or being on the autism spectrum for the first time when they came for these evaluations. Also, 5% with major depressive disorder and 3% with OCD or generalized anxiety disorder. In terms of their mental health history, 64% had a diagnosis as well as being transgender. And in terms of what these histories were, very few had learning disorders, very few had intellectual disability, um, but 10% had tried to commit suicide and 30% had suicidal ideation but hadn't made an attempt. And in terms of self-harm, 20% had self-harm with suicidal ideation, and 5% non-suicidal self-harm. Sorry, I'm rushing, but there are a lot of uh, facts I'm trying to get through, and you're welcome to read the article which has been published in the South African Journal of Psychiatry. In terms of medications, 38% of them were on psychotropic medications, and the majority of those were on an SSRI, fluoxetine, which is helpful because it tells you these patients were probably being treated with the right medication. but 10% methylphenidate, so quite a high incidence of ADHD. Interestingly, with substance abuse, I actually thought this was relatively low, with 16% either having used alcohol or cannabis. It didn't mean it was abuse, but they hadn't necessarily turned to alcohol or cannabis in high percentages because of their distress around their gender. In terms of mental health at assessment, the majority were euthymic and apsychotic, so not depressed and not psychotic. But 9 were depressed, and 4 were anxious, and 1 was psychotic. So the limitations of this study were that large numbers were clearly not referred. The study took place in the Western Cape, but unfortunately, it is the only gender clinic for children and adolescents, as far as I'm aware, operating in Africa. And there were no standardized assessment tools used, but the same clinician myself has a special interest in supporting young people with autism spectrum, and 5 of the 10 who were diagnosed with autism spectrum later had a DISCO, or a diagnostic assessment, which did indeed show that they were on the autism spectrum. Also, we looked at risks, not really resilience and positiveness. So in conclusion, this was the first study describing gender diverse youth seeking support relating to their gender identity in Africa, and they showed that they had remarkably similar profiles to those studied internationally. However, it is a very important study because we now know that youth of all races with similar demographic profiles found internationally present in services in South Africa and are in need of mental health and support interventions. You don't get any money until you've done a study and proved it on paper. It's important that clinicians are aware of the presence of gender diverse youth and their possible demographics and their needs in South Africa. And this is the first study to help them in this area. And I'd like to thank my co-authors, Dr. Graham de Beaver, Dr. Eugene Davidson, and Prof. Petrus de Vries, for their support and participation, and of course, all the transgender youth and their parents.